First, I wanted to start with what I would refer to as the master gardener of this whole plot in the nation. The plot to make health IT innovation really happen and make healthcare better. There's one person that maybe not as many people know as they should, but someone who we were sitting in a bar 7 months ago, last night, or standing in a bar, I should say. We came up with this crazy idea and kept plowing and having people help us and suggest ways to do things, and kept saying to us, "Are you sure this is really worth it?" I can't say that we always were sure, but we kept plowing ahead anyway, because that's the way we do things, and that's our version of innovation. And I'm thrilled here to have this morning Will Yu, who's a special assistant at the Office of National Coordinator for Health IT, special assistant for innovation and research, and also, because none of us like wearing only one hat, he's a senior advisor in CMS Innovation Center. And we're thrilled to have him here and make some opening remarks to us. Thank you, Will.
Hello, everyone. Can you all hear me? What a wonderful space. People who come here often must just walk around with incredible thoughts just bleeding out of their heads all the time. What a wonderful group of people assembled here today, bright and early. It's my honor and privilege to be here, and I really sincerely mean that. As Mike mentioned, I work at the Department of Health and Human Services, specifically with a very passionate, enthusiastic group of individuals championing innovation across the country. And really, we have an earnest belief that government should be a strong facilitator of helping innovations grow, to be diffused across the country, that the private sector should have every resource possible, okay, from the federal government, our public servants, to support these endeavors. And we're trying to do this judiciously by promoting communication, collaboration, and judicious support. I firmly believe, I know that the day will be coming very soon in which we are intensely focused as a nation on healthcare, on quality care, on care coordination, and that we will have a robust health IT infrastructure to support that world. Information is going to be exchanged appropriately, privately, and securely, but it will make its way to the individuals who desperately need it. Information is the lifeblood of medicine, whether it be to the clinician, to the policymaker, decision makers within an organization, and of course to the patient and those who help to care for the patient. That is the central focus of everything we do. But I also know that world is not going to happen on its own. It will not happen by itself. It's going to take dedicated individuals, folks like Vikas and like the folks at BluePrint Health IT, folks like the ones that are on the advisory committee who have been working months to help put on this first of kind event in the nation. It's not going to happen on its own. The ability for us to improve quality, to bend the cost curve, to do all these great things that we talk about in concept, it's going to take hard work. It's going to take the assumption of risk. It's going to take an appreciation of the world and a desire to change it towards a better vision. And I applaud all of you for coming together today in recognition of that, and to take advantage of the wonderful opportunity that is being afforded us today. Okay, really, I said this yesterday, and I'll reiterate today. This is a first-of-kind event in the nation. You all are helping to lead the way and are pioneers in promoting a very worthwhile endeavor in support of innovation in healthcare. Let me take a step back now and tell you a little bit about what we are thinking in terms of supporting innovation, both for innovators and those who would seek to implement them, because I've been talking a little bit about this in the abstract. with specific respect to, I guess, those who would seek to develop, those who would take the crazy risk of working within health IT and trying to develop new technologies. I know that there's a little touch of crazy in all of you, because why would someone try and pioneer in such a difficult space? Okay, and it's something unusual that drives you all. I know that, and this is from I guess several hundred meetings over the last few years, that innovation doesn't take place, okay, where we always have a very set roadmap of start to finish. It progresses through stages, from the creation of an idea, the initial concept, development of a prototype, getting to a proof of concept stage. One of the most critical stages of development and refinement, to your first deployment, development, and then a gradual progression to a level of maturity. We're trying to support progress through each of these stages, not by picking out the winners and the losers of technology. I have people come into my office all the time and say, "Will, we really need to meet with you. We really need to meet with the national coordinator or even the secretary. And if there are specific issues that we can help you with, that's great. But if you think the key to success is having a personal relationship with myself or a single individual within the government, I failed." Okay? Okay? I cannot be the arbiter of what succeeds and what doesn't. What I need to do is help create an environment for you all to succeed, okay? For you all to at least have an honest shot, okay, at getting those concepts realized. Okay? Not every idea will make its way into fruition. That's just the natural state of things. But at least if you're going to fail for the right reasons. Okay? Not because there's an artificial barrier that has kept you from moving through those stages. Okay? So this event is very near and dear to my heart, because it helps the innovators get to that proof of concept stage. If you have an idea, if you've developed a prototype, and those were one of the several of the criteria that were necessary for, I guess, inclusion in this wonderful group. Have something that can be deployed, that can be tested. Okay, find an environment that can actually allow your, I guess, technology to be nurtured. Okay, the end result won't be what you came in with. Okay, but I guarantee you, you're going to learn a lot from the process. Take advantage of that opportunity. Okay, we have other programs and initiatives that I'm more than happy to talk with you all later to support both very early stage innovation and late stage innovation. Okay. But this is the proof of concept stage that is traditionally the hardest barrier for those who seek to take that crazy path into this world, okay, to get over, okay? And if we can just make it a little bit easier to develop, make it a little bit easier for those who've invested so much of their time and energy, who've risked, I guess, their livelihoods, whether they be in small organizations or larger organizations, okay, then we can look back on this event with a bit of pride. For those who seek to, I guess, be more innovative, the adopters, the healthcare systems, care organizations, that's kind of where I put my CMS Innovation Center hat on, because I certainly appreciate the very volatile environment that you all are facing today. It's not been easy facing the challenges of shifting demographics, changing utilization, not to mention one of the greatest recessions we've ever seen. Okay? Add to that the policies and programs that we're pushing down right now through the federal government to support that realized group. Our brothers and sisters in arms at the RECs and the HIEs programs, as well as the beacon communities, know very well that they're putting a great deal of pressure, okay, on these care organizations, and we're very mindful of that. But progress must continue, and we're trying to put together resources to support you all as well. What I would like to see from these organizations, and where we can be of most help, is to help get you all to a place where you're very comfortable with a changing environment. As the seas shift under you, okay, as the level of visibility becomes a little murkier, what can we do as a federal government to support your ability to institute organizational innovation? How can you better adopt and diffuse? Not for the sake of adoption, okay, but it is for the sake of aligning your internal strategies with the changing environment. And if we can be of support that way, then we would, I guess, be very open to that. Part of my job within the CMS Innovation Center is to support learning and diffusion of these technologies and how to respond to that environment. Not because that is, I guess, my natural area of expertise, but we can act as a source of collaboration, as a source of communication to promote that level of understanding. Okay? So it's my hope that that you all will take advantage of the day, just as you take advantage of this space, and really see this day for what it is. It's an incredible opportunity, okay, for yourself as an innovator, or yourself as the representative of an organization that is clearly going to need to innovate in order to adapt to the changing environment. I'll look forward to talking and collaborating with each and every one of you in the future. But for now, please enjoy the day. And once again, thank you to the BluePrint team as well as the advisory committee for helping to make this day a success. Thank you.